Happy Monday, everyone. Welcome to our 2023 Treating the Whole Person Optimizing Wellness virtual conference. Today is a special day as we're kicking off our conference, which is streaming live on Facebook and YouTube for the first time ever because it's CRPS Awareness Month, also known as November, and it's the 10th annual Color the World Orange for CRPS/RSD awareness. Thank you to the entire team at Color the World Orange for being amazing, as it is an independent initiative that we are so thankful for. And as you can see, I'm rocking my orange here today. And speaking of who we are, my name is Alexis Johnson. I'm the social media manager here at RSDSA. I'm joined by Jim Broach, Executive Vice President and Director of RSDSA, and Dr. Elan Schneider, the first guest in our annual virtual conference, as he discusses insights on how our nervous system adapts to alter our experience of pain and neuroplasticity as well. Now, we've had the honor of having Dr. Schneider join us before, but as a reminder, he is a physical therapist specializing in neurorehabilitation of chronic pain. He co-founded the Retrain Pain Foundation, a nonprofit dedicated to pain education, and has created educational content used in pain clinics throughout the world in over 30 languages. Elan's also the co-founder of TrainPain, a digital health company developing novel technology for pain-related neuroplasticity. Elan is optimistic about the future of pain care as he is a passionate advocate for public awareness of modern pain science and its implications on policy, healthcare systems change, and improve patient-centered care. As always, remember that while the information shared here today is helpful, please consult your physician for personalized medical advice. And be sure to leave your questions in the chat on Facebook and on YouTube, and we'll get to them at the end. Jim, anything you wanted to add on before we turn it over?
No, I just wanted to remind people that his previous lectures are on our YouTube channel, RSDSA, and they're fabulous. And we're really excited that he's back again, and that take it away, Alexis.
All right. Well, yeah, I'm done with my piece. So Dr. Schneider, the floor is yours.
Okay, thank you very much. I'm really honored to be here. I appreciate the opportunity to be part of this event, and a big fan of everything that RSDSA is doing for the community. And I'm very, very honored to be here. I want to start by first expressing, acknowledging what the people in the CRPS community are going through. I can't imagine what it's like to live with CRPS. I've had the opportunity to work with many patients, but I haven't had CRPS myself, and I acknowledge that is extremely challenging journey. And so I hope that what I shared today will be helpful and inspiring in some ways. But I in no way want to make it seem that CRPS is something that is easy to live with or easy to overcome. I know it's a very challenging journey. So today's topic, we'll be talking about neuroplasticity. My interest is from a few angles. So I grew up living with a close family member who had very severe neuropathic pain to the point that it was that they didn't even want to live anymore. It was so difficult for them. And so I grew up around people who were in pain. It's something that's very close to my heart. And I'm a physical therapist, and immediately out of physical therapy school, starting to work in the clinic, I saw how difficult it is to treat pain. And I also saw how difficult it is to understand pain, that so many people have symptoms that don't really seem to make sense based on the models that we've learned and worked with in the past. And so I got very interested in this area, started studying different approaches, and really got very interested in neuroplasticity and neuroscience in particular, because I saw that there was hundreds and hundreds and hundreds of research studies that brought up so many interesting insights that could explain what people are going through, and also new avenues and opportunities for treatment that weren't being used, that people weren't aware of. And so I see it as my mission to help translate and take some of these ideas from the neuroscience literature and make them more available for people in the community and for healthcare professionals to be aware of them, and also to build new tools that will use these ideas, that people can actually take advantage of these different ideas in their own care. So in today's presentation, I'll be talking about neuroplasticity, what it is, and its role in pain, its role in recovery, and some different ways that we can harness it. So neuroplasticity basically is an ability. It's an ability of our nervous system to change. The neurons, the nerves in our nervous system can grow, they can sprout, and connections between different neurons in our nervous system can change. So the actual pathways that run in our nervous system are constantly adapting, constantly changing. And that's what neuroplasticity refers to. It refers to this amazing ability of our body to actually physically restructure itself in response to our activities and our environment. So neuroplasticity, it sounds very complicated, but it's something we're all familiar with. It's something that we know about every day. It's how we learn anything. So neuroplasticity is the reason we can learn information. We can learn a new language. We can learn a new subject. It's also the way that we can learn any new skill. So if you remember the first time you were driving or the first time you were on a bicycle and it took a while and it took a lot of effort and eventually it got to the point where you could do it without even thinking about it, that's neuroplasticity. That's a learning process. And that learning process involves changes in neurons, changes in how neurons communicate with each other. It involves growth of neurons, and it also involves changes in the pathways. As we learn things, certain pathways get stronger, certain pathways get weaker, and then it becomes easier to do those things with less effort. So who cares? Why is this so important? Where does it have relevance? So one area where it really has a lot of relevance is the field of rehabilitation. So there was a lot of interest in neuroplasticity when it came to things like strokes and other injuries or diseases of the nervous system, where a person would lose a certain ability. And it was thought traditionally that people didn't have the ability to, the nervous system was kind of set. They didn't have the ability to change. And so in the last few decades, with all this research about, in fact, the nervous system can change, there have been a lot of new approaches to rehabilitation, to treating things like strokes and traumatic brain injuries. And there's been a lot of research in those areas on what do we actually need to do to create positive neuroplasticity, to actually retrain the brain and help it change and relearn how to do things that it no longer could. But the other area where we're getting a lot of interest now in neuroplasticity is around pain. We now know that people with chronic pain, that one of the things that really maintains and is creating the symptoms is a certain type of neuroplasticity. And that's what we'll be talking about today. And the most important thing to know about neuroplasticity is that we can influence it. So it's something that there are aspects of neuroplasticity that occur that are outside of our control, but there are a lot of things that we can do that actually can push and drive neuroplasticity in certain directions. So we're going to start now in talking about neuroplasticity's role in the development of chronic pain and the maintenance of chronic pain. So after an injury, many of us, even a small injury like even a sunburn, you'll notice that the area gets really sensitive right after the injury. So you feel the pain maybe at the moment that you do something when the injury happens, but then after that injury occurs for typically the next week or few weeks, the whole area around that injury will get sore, it will get sensitive, and that's a normal process that should happen after most injuries. You'll see redness, you'll see inflammation, and you'll see that hypersensitivity where something that didn't hurt before, like touch or gentle movement, will now create pain. That's called sensitization. So that's a type of neuroplasticity where the sensitivity of our nervous system gets elevated. And it's a physical process that we're going to talk about in just a moment, where the volume gets turned up. It's like a microphone that's extra sensitive and picks up every little thing. This is a change that happens in the nervous system after an injury. And it reminds us to be extra careful. So it has this really helpful role. You're in the healing process after a few weeks after an injury, and this extra sensitivity is telling you be extra careful. You need to rest. You need to protect the area. You need to avoid walking on it or avoid doing rigorous activity so that it can heal. So this sensitivity, the sensitization process of nerves changing and getting extra sensitive is a normal, healthy thing, but it's only supposed to occur for a short period of time and to a certain extent. This process of sensitization, it occurs all over the nervous system, but I'm going to give you one example of where it happens, and this is something that happens in CRPS. So normally in our body, we have different nerve pathways for different types of sensations. So we have a set of pathway of nerves that are involved in gentle touch. So if you were stroked with a feather or touched on your hand, there's a very specific set of nerve pathways that would bring that information to your brain, and you would become aware of that touch. We have a different parallel set of pathways that are involved in danger detection. So if you were punched, or if you were pinched very hard, or if you had fire, something really hot touch your skin, there's a completely separate pathway that brings that kind of information to the brain. What happens in neuroplasticity is that neurons can sprout, and your body in the spinal cord can start to create connections between these two pathways that are supposed to be separate. And when that happens, when you get a gentle touch, those pathways, those nerve impulses in your spinal cord now have a second kind of avenue or second road, and they connect to the danger detecting neurons. And so even if there's no fire or nothing there anymore that's dangerous, a gentle touch will trigger those pathways that should only normally turn on when you have fire. And it can feel like, it will feel like the gentle touch feels like fire, feels like you're being touched by fire. So this is a neuroplasticity that occurs in the nervous system. That's a physical change, and it's something that we know happens in conditions like CRPS. These different changes of this hypersensitivity, these changes in these different pathways, they happen throughout the body. So they happen in the neurons in your skin of the limb where you're injured. They happen in the spinal cord. That's what I was just showing. They happen in brain pathways. So the different pathways in the brain that process information about pain, they start to change and get more sensitive. And your brain starts to create new connections between different areas. Like, for example, the areas that are related to emotion and fear and threat, they start to develop really strong connections with the parts of your brain that process sensations from your body. And so when that happens, even gentle sensations trigger these huge reactions of fear, and that then actually amplifies the sensations that you feel. So these are some of the changes that occur that create more pain. What does it feel like? Well, when these things are happening, several things change in what we feel. So things that are actually not dangerous for our body, like a gentle touch or a gentle movement, create pain. So safe things create pain when you have this kind of sensitization. Another thing that happens is that there's a wider range of things that can create pain. So for example, normally when a person feels stressed, it's unpleasant, but they don't feel pain, right? They feel stress. Well, when this kind of sensitization happens, stress chemicals themselves can actually trigger these different pathways related to pain. And so stress itself can become a trigger for pain. Another thing that happens when you have this pain-related neuroplasticity is that pain can start to spread. So it can spread in a single limb. So the area that got injured, you feel sensitive, not just exactly where the injury occurred, but you start to feel sensitive in areas nearby. And it's possible for pain to actually even switch to a different body area. So if you could think like, you could have an injury and a problem on one hand, and you can start to get sensitivity on the other hand. Now, when I hold my hands here, it looks like my hands are really far apart. So it's like, how can pain sensitivity jump from here to over here? But in our spinal cord, the nerve pathways for my two hands are actually really close to each other. And so that sensitization process that's happening for the neurons from this hand can actually spill over and create sensitivity in the pathways in my spinal cord from the other hand. And that's one of the mechanisms behind the potential for spreading of pain. And the last thing that can happen is the spontaneous pain, is pain where, out of nowhere, the neurons are just turning on. And so what, scientists have been able to, use this information is to explain symptoms that previously were very difficult to explain. So if someone had an injury in one hand, and then all of a sudden they were developing pain or sensitivity in the opposite side. They might have been told that it was psychological or they were catastrophizing, but these types of findings, this new science actually shows that these are physical things that occur in the nervous system. They're not psychological. People are not making them up, and there's a real biological mechanism for it. So here are some of the, at least the takeaway points that I have from this information. Number one, what I just mentioned, this sensitization is a physical process. This is not psychological. It's not imagined. It's something that takes place in our neurons, no different than if we learned a new language or learned a new skill. This is also a type of learning that can occur in our nervous system. The second thing is that it's microscopic. And so even though it's biological and it's physical and scientists can actually measure, see these things, it's happening at a microscopic level. So these are not things that you see in an MRI machine. These are not things that you see in an X-ray. And these are not things that you would even see in a blood test. These are things that are happening at a microscopic level. And we don't really have any way yet in the clinic to see this in a patient. This is generally seen in animals and other ways that can't be done in the real world. The third takeaway point is that some sensitivity is helpful. So that's what I mentioned earlier, is that every time you have an injury, there should be some level of sensitization, and that's what helps us protect the area. The problem occurs when that sensitivity sticks around for too long, or where that spreading of pain spreads too far, or where the amount of sensitivity just goes absolutely out of control. Instead of it being just a little bit more sensitive, it becomes a lot more sensitive. And this is now how many people are understanding conditions like CRPS, where CRPS, even though we don't fully understand CRPS, we know that this is a component of what's happening, that the normal healthy process in our body for creating extra sensitivity gets out of control, and there's too much sensitivity and it sticks around for too long. And the last practical point, which is probably the most important, is that these things are reversible and that these things are changeable. And this sensitivity is actually the target of our treatment. Okay. And so someone who's been living with pain for a long time, and they're going to the doctor or they're going to a therapist, the question really becomes, what can be done to reduce the sensitivity? What can be done to change some of this pain neuroplasticity? And at a certain point, the treatment is less about treating whatever the initial injury was or whatever that initial trigger was. And the treatment becomes really, how can you reduce the hypersensitivity and how can you change some of this neuroplasticity? Okay, so maybe before I go on, does anyone have any questions? I'd be happy to answer some questions, because we're going to talk now a little bit about treatments and some different directions and some hopeful science. But before we do that, maybe there's some questions about the side of neuroplasticity that increases our sensitivity. Okay, so someone asked the question that it's harder to retain knowledge, especially on higher pain days. Does this relate to neuroplasticity? I think the answer is yes. So this experience of it being harder to concentrate, of brain fog, of just more difficulty thinking, this is an active area of research. It's been something that was researched quite a bit in the 1990s, and ever since it's an objective. It's a common experience, number one, and it's definitely a real thing. It's harder to think, it's harder to make decisions when you're in a lot of pain. Our brain processes a lot of information all the time. So right now, there's sounds in the room that I'm in. I have different feelings all over my body. I'm concentrating on what I'm trying to say, and my brain is trying to process all of this. And my brain has to figure out what's the most important thing for me right now. And all the things that are not important get filtered out. It's like I start to not notice the sounds in the room when I'm focusing and really trying to figure out what I need to say in my presentation. So pain is something that tells the brain it's the most important thing. Pain means danger generally. Pain means there's a problem. And so pain has this natural ability to grab all your attention, and it makes it very difficult for the brain to focus on other things. Now, that alone, I don't think is neuroplasticity. I think that's just a priority, how the brain prioritizes what's important. Pain becomes most important, and it becomes harder to think through other things. But where neuroplasticity comes in is when you have pain every single day, and you have pain for weeks and weeks and weeks and years, the brain starts to automatically prioritize pain. It knows, okay, I have a problem in my right hand, so everything in my right hand is important, and the brain is going to prioritize. It's going to learn to prioritize signals from the right hand, and that becomes a habit, and those are circuits that get reinforced. And at that point, it's neuroplasticity, and it's more of a learning and a change that happens. So I hope that answered that question. I'd be happy to talk about it more after. Okay, how did they actually find out about it? Why are they able to track it in an animal and not in a human? Okay, so the science of neuroplasticity hasn't all been around pain. So a lot of it's been studied in neurological injuries. It's been studied in Alzheimer's, in learning. So it's coming from a lot of different fields, not just specifically in pain. It's studied in different ways, but one of the ways it's studied is in animals. So they will do things with animals. They will try to create different types of neuroplasticity through the animal learning something, through the animal doing an activity. Then, unfortunately, they sacrifice the animal and they do microscopic examination of the cells, of the different circuits. There's other techniques also, but often it involves an animal being sacrificed for science. And so obviously that's why it can't be done in humans. Okay. So we talked a bit about, the side of neuroplasticity. I used to call it the dark side of neuroplasticity because chronic pain is a dark. It's not helpful. It's not something that we want. But now I prefer to think of it as a helpful process that's gone, out of control and stuck around for too long. So now let's talk about the hopeful side, the positive side of things that we can do to make change. I put here a picture of a butterfly because that's the image I have in my mind of how biological systems can change. Biology can transform and can change, just like it can happen for a caterpillar and a butterfly. It can happen for us as well. So this is a quote from a friend of mine who's lived with pain, and she says, "Our biology is always changing in response to new and repeated experiences." So the way we drive neuroplasticity is through new and repeated experiences, and that incorporates things that we do, see, feel, hear, the people we interact with, and the places we go. So let's start first by talking about kind of what do we know in CRPS specifically, and positive neuroplasticity? Can there be positive changes? So we know from several studies in CRPS that good therapy can reduce pain, it can reduce emotional distress, and not only that, after therapy, there can be changes in brain structure, healthy changes in brain structure, and healthy changes in brain connection. So these specific changes are things that can be seen in certain types of like functional MRIs, and that's what we're going to look at. So here's one example. Well, before I get to the example, what these researchers were looking at was they looked at patients' brains who had CRPS before they went to therapy, and they saw increased and strengthened connections between the amygdala, which is in charge of fear and threat awareness, and the sensory parts of the brain. And so, as I mentioned before, every time you get a sensory input, it activates those fear protection areas of the brain, which amplifies the sensations. And what the researchers showed was that after the therapy for CRPS, those connections, which were abnormally strong, were weakened after the therapy. So the connections between the amygdala and these other sensory and motor areas of the brain were closer to normal after the therapy for CRPS specifically. And here's another example. We know what these researchers found that in CRPS and other types of pain conditions, not just CRPS, there's certain structure of the brain called gray matter. It's where the cells of the brain are in certain areas. That gray matter can be reduced. It's a measurable structural change in the brain of many people with different types of chronic pain. And they were able to show that after therapy, those brain regions increased the gray matter. And so what these studies showed is that physically they could measure changes in the brain structure that went along with the different improvements in therapy. So what are some of the ways that you can drive this positive neuroplasticity, to drive the positive changes in the brain? So one example is the environment. So this is a whole host of studies that have been done with rodents generally, rodents with nerve injuries, and they put them in the normal environment, which you can see here on the left, just a simple cage, versus putting them in an enriched environment, an environment with a larger cage, an environment where they can move around, an environment with toys and diverse food and more opportunities to explore and learn. And what researchers have seen, both in animals that had a recent injury and also animals that had already neuropathic pain from an older injury, that these types of environments can create changes in the system. So for example, environment enrichment can reduce nerve injury induced hypersensitivity to mechanical and cold stimuli. So that's basically after an injury, you get really sensitive to touch or to cold temperatures. And what they were able to show in the animals was that being in these enriched environments could reduce that hypersensitivity. And in contrast, being in an impoverished environment exacerbates the mechanical hypersensitivity. And so to me, this is really profound because it shows the effect that our environment has on our pain system for people with pain. And pain makes us want to go, makes us want to not go out, it closes in our space, it closes in our environment, it closes in our range of different things that we can engage in. Yet we know that range of life activities, of experiences, is actually really important for reducing that hypersensitivity. They've also done experiments with animals putting in the cage healthier food, and also companionship. So giving the animal a companion to be with. And this I wanted to show you because I think it really drives home the point how physical this is, how this is not just something psychological. These are microscopic examinations of the spinal cord in the animals. And here they're looking at two specific chemicals that play a huge role in how much pain we feel, dopamine and serotonin. And they're looking at animals in kind of the standard condition where they're eating just the regular diet and they don't have that extra companion, as compared to the condition here where they're eating a special diet and they have that companion. And the scientists can actually measure an entirely different concentration of serotonin, of dopamine, inside of the spinal cord. And so these environments, these healthy foods, these companionship, these are all things that have a physical effect on our neurons, on the neurotransmitters, and on sensitivity in the nervous system. So kind of moving from laboratory to real life, thinking about that, that enriched environment for the rodent, what would that look like for a human? How do we create an enriched environment for a person? And it's going to be different for everybody, and everybody has a different range of possibilities that are available to them or are an option. But one component of it is this component of voluntary. So we now know that it's very important that people have the ability to voluntarily engage in these different experiences. It's not something that can be forced. And in some of these studies where they force certain experiences, and that stress of being forced to do something can actually counteract some of the benefits. But opportunities where you can voluntarily explore, engage in novel or different types of sensory experiences, experiences that are engaging and playful, obviously positive social interactions plays a huge role. And movement, just being able to move, doing as much movement as possible can have a really big impact. I crossed out the word exercise because, we really shouldn't be thinking about it in terms of like just, structured exercises or very specific exercises. It's really any movement, the more enjoyable, the more meaningful it is to you, the better it is when it comes to this, thinking about enriched environment. The other aspect of positive things we can do to drive neuroplasticity is targeted training. So we talked about the environment, what's around us, but there's also, we can engage in specific training to drive neuroplasticity. Okay, so we're gonna start on the left column. We can train neuroplasticity in many of our body systems. So for example, we can train neuroplasticity as it comes to movement. So anytime you're learning a new skill, you're learning a new sport, you're training your motor system, you're training neuroplasticity in the motor system. That's something that's obviously relevant in rehabilitation from something like a stroke, but it's also relevant in living with pain, because aside from the sensory experience of having pain, we start to move less, or we move differently. We move in different ways to try to avoid the pain. And so targeted training can be done for the movement system. Targeted training could be done for our stress system. So we all have different stress or fear triggers, but when we have pain or we have a traumatic experience, the amount of things that can trigger our stress experience start to expand. So we can wind up with a wider range of triggers, and that can be trained. So we can do specific training to reduce fear, specific training to grow more accustomed to being things, whether it's, being in a certain environment or being around someone, or, even thinking about movement. The stress or fear system can be trained. The cognitive system can be trained, obviously, so we can train our brain to get better at its attention. We can train our focus. We can learn new knowledge. But the systems that I think we don't think about often enough as it comes to training neuroplasticity is our sensory system. So we can actually train our sensory nervous system. We can train our system to get more accurate. So if you can think about someone who, if you have a novice or someone who doesn't drink wine a lot, they smell wine, they might not notice all the different nuances of a smell of wine, but someone who's been doing it for a long time can actually train their senses to be able to notice things that a novice wouldn't notice. So we can train our sensory accuracy. We can actually get more accurate in our ability to sense what's going on in our body and from our senses. And we can also train our responses to sensations. So if there's sensations that trigger fear, trigger discomfort, we can actually retrain to a certain degree the responses we have to sensations. And that's something I'm going to talk about in just a moment in a very specific, practical way in CRPS, that kind of training. And I'll get to it in just a moment. So those are some of the different systems that we can train. Some of the components that are critical to doing these kinds of training are repetition. So there's a phrase, neurons that fire together, wire together. The more you have to do these things repetitively, whatever training you're doing needs to be done repeatedly, and it takes time. It's the repetition that actually creates change. As I mentioned, any sort of training for neuroplasticity needs to be voluntary. It's not something that can be forced. And we're going to talk in a moment about sensory training, and that's something that needs to be engaged in, from a person's own free will. It's not something that can be done or forced on someone. Training should be meaningful. It should engage your emotions. So I'll give you an example of that. So researchers did a really interesting study where they were looking at how people can learn to get more accurate in their senses. And so they were playing different frequencies of sounds, and they were looking at how well you can differentiate between similar sounds, how accurate you could be, and then doing that repetitively to get better at it. And in one of the groups, it's a very complicated study, but simply in one of the groups, they had them playing Tetris and had them playing video games in between the training sessions. And they found that the groups that were playing games in between the different training sessions had much more learning occur. And what the researchers concluded was that playful, rewarding experiences release dopamine in our body, and that dopamine drives learning. And so if we can be emotionally engaged in whatever training we're doing, positive emotions, rewarding experiences, that can really make neuroplasticity training much more impactful and effective. Another thing is training in multiple contexts. So if I'm training, for example, let's say I was trying to train myself to react differently to a different stimuli. So there's something that triggers my fear. and I want to practice being able to be in its presence and being able to be relaxed and doing that again and again. It's important to train in different contexts, to train in different environments, train on different days of the week. Because if you just train, in a very, in your room, it's not as easy for that impact of that training to happen when you're out of your room or when you're at work or in some other stressful experience. So any training should be done in multiple contexts. And when it comes to pain and CS, one of the key things that we're trying to train is a sense of safety, of not feeling, training your brain to feel safe. Because pain, a lot of the systems that are involved in pain and amplifying pain are systems in our nervous system that are involved in threat detection and overactivity in these systems that detect threat. And so training ourselves that we are safe, that when we're touched, and we're going to talk just in a moment about sensory training, the kind of the core theme in training for pain, whether it's training with movement or training with sensory training, is we're trying to train the brain and teach the brain that it's safe, that it's not under threat. So let's talk very specifically and practically about sensory training. So I imagine anyone here who has CRPS, who's been to therapy, has undergone some form of sensory training. So the old form of sensory training was basically just to rub the area that was affected. So rubbing it with different textures, touching it, and trying to desensitize it through just passive stimulation. Sometimes this is done, it's forced. It's obviously something that's very painful and unpleasant, but this is generally how it's been done traditionally. Over the last few years, there's been a shift in how sensory training is done. And it's thought about more in retraining nerve pathways. So instead of just touching and touching again and trying to desensitize that way, we retrain the brain pays attention and responds to sensations from the body part. And this is training sensory perception. I'll give you a few examples of it. So in one study here on the right, this was a study in CRPS where the researchers did a training where they would touch the patient's hand with two different probes, either a big probe or a small probe, and they would touch different parts of the hand, either location 1, 2, 3, 4, or 5. And the patient would look away, and the patient had to answer a question. Which probe were you touched with? Were you touched with the small one or the large one? And which part of your hand was touched? So this kind of training is quite different than the older method where it was just, rubbing the hand passively. In this, you're paying attention, you're thinking, and you're trying to train your brain to pay attention in a different way to that body part. Instead of paying attention with fear and that kind of pain response, you're focusing on, well, what exactly are those sensations? What exactly am I feeling? Where am I feeling it? You're also giving novel and different types of stimulation, and you're engaging whole different areas of the brain. Now, this study, which showed that they were able to relieve some pain and also improve sensory function, it used some very complicated laboratory machines. So a few years later, some researchers looked at doing this in a more simple way at home. And what these researchers did is they had people with CRPS train with Braille. So trying to detect Braille with their fingers using these little Braille dots at home. And so the same idea, the patients would explore the different sensations. So they would touch it, and instead of just trying to rub it and tolerate it, they would pay attention and try to think and almost turn it into a game of trying to figure out what exactly am I feeling, and training those nerve pathways that pay attention to the body in a different way, in a less threatening way, in a safer way, and also trying to retrain accurate perception from the body part. And they were also able to show a meaningful improvement in pain from these types of training. Now, in another study that wasn't for CRPS, it was for phantom limb pain, where this kind of training was done, the researchers also looked at fMRI machines, at brain scanning machines, able to see that not only does the training reduce pain, but it also changes organization in the brain. And that's something that the researchers could measure with an fMRI machine. I want to just because I brought up the fMRI machine, I wanted to just mention something that someone asked about earlier, is why is this hard to measure in the clinic, or when you're actually a patient? Why is it hard why can't a doctor just do a MRI of your own brain and measure these changes? I forgot to mention that a lot of these changes are very individualistic. They're different for each person, and the researchers can see the change the most when they take the average of large groups of people. And when you look at just one person, it can be harder to see. But when you look at a very large group, the changes before and after, that's when you really can see the changes. So that's one of the reasons why it's hard to see these changes for individuals in the clinic. So back to the sensory training. So just to kind of highlight a few of the keys of this kind of training, and this is something that anybody can do on their own, and we're putting on our website more information about some of the different ways that this can be done. Some of the keys is that it should be not painful. So that's very different than the kind of sensory desensitization training that many people have done in the past. The goal of this is to do the training in a not painful way. So if the hand is too sensitive to do the training, we do the training nearby. So if you can't touch the hand, it's too painful. So we'll do it, on the forearm or the elbow or the shoulder. We'll do it in the closest area to the affected body part that you can tolerate the training. And then over time, moving it closer and closer. It's okay to do it like in the gray zone where it's a bit uncomfortable, but you don't want to be doing these trainings and feeling excruciating pain, because all that's doing is keeping those pain pathways going again and again and reinforcing the fear, the threat activity in the brain and the nervous system. So we're trying to train the brain that it's safe. And so it's best to be done non-painful or just with discomfort. It's important that the training is done in a meaningful way. So things that you can do with your hand that actually mean something to you, that have to do with a hobby, have to do with something that you enjoy doing, is going to make the training more effective. And when it comes to doing these kinds of sensory perception training, it's important that it's challenging, because we want to be engaging the brain and attention fully. And so we want these exercises to be done in a challenging way. So in the clinic, I saw a lot of benefit for people doing these kinds of training. And it was the inspiration for why we started TrainPain, because these kinds of trainings, you can do it on your own without any equipment with a partner, but it's very difficult. And so we created in TrainPain a system to do these kinds of trainings at home. And I want to explain a little bit about what we're doing, because this system is available to you, but also, even if you don't use the TrainPain system, there's things and ideas that you can learn from it that you can replicate at home on your own. So what we do in TrainPain is we have a tactile stimulator. So this is not like a TENS device. It gives a very gentle vibration, very brief, almost like a phone that's ringing or an Apple Watch, a very gentle touch sensation. And we play video games where the clue to solve the video game is actually the pulse that you're feeling in your body. So you'll feel different types of patterns, and those patterns are clues on how to solve the puzzle in the game. And so in order to play the game, you need to pay attention to your body, where the pot is, and you need to try to interpret the sensation to accurately detect it, figure out what's going on. And so what we're doing is we're training the brain to pay attention to the body in a playful way, in an accurate way. And what we do as well in this system is we have different pods on different parts of the body, painful and non-painful parts of the body. And during the training, you have to shift attention. The game will tell you, pay attention, let's say, to your left painful hand, for example. Tell me what's going on there while ignoring another body part. And then it will have you shift attention away from the painful hand, and then towards the painful hand, and then away from the painful hand. And what we're trying to do is to train the brain to be more flexible in how it pays attention to the body. Because when we live with pain for a long time, with a condition like CRPS, the brain becomes conditioned to over-focusing, to over-prioritizing information, its attention to information from the affected body part. And what we're trying to do here is training the brain repetitively, thousands of times, to be more flexible in how it shifts attention, and to pay attention to the body and sensations in a playful way, in a rewarding way. And so on our system, patients do this training 15 minutes a day, once a day, for several weeks. And we've seen, while it doesn't help everybody, we've seen some really positive and encouraging responses, particularly for people with CRPS. And here's a quote from one of our members. She said, "I know of nothing else like it. I noticed my foot is definitely feeling less angry than usual, and there has been a remarkable change in the sensations in my toes." And so we've seen really encouraging results, but I also want to be clear, this is not a cure for CRPS. It's intended to be part of a broader self-care program, and it enables people to do their sensory training in a more engaging, fun way from the comfort of their own home. Okay, so let's review some of the practical points. Number one, it is possible to change our nerve pathways. We can see that in animal studies, and we can see that in human studies, and in particular, people with CRPS. Point number two is that this ability to make changes in our nervous system through changing our environment or through targeted training is something that we have the power to do. This is not something that we need to pay a lot of money for. It's not something that we have to go somewhere else for. There are things that we can do on our own by ourselves to drive this change. We can create the most change when we're engaging in experiences, sensory, motor, movement experiences that are novel, that are engaging, and that are continuing with that theme of feeling safe. Neuroplasticity requires repetition. It needs to be done in a voluntary way. And the more we're doing things that are meaningful to us in our training, whether it's a movement training or sensory training, the more effective it's going to be. There is no one-size-fits-all approach. There's no one technique or one approach that's going to work for everybody. Each person needs to think about, what is something that I want to be able to do? What's something that I want to train? What is an environmental change that I want to make that's relevant for me? And it could be that the first thing you try doesn't wind up being the most effective thing, and that it takes experimentation, and it takes a few different approaches, and it's slow, but there is no one-size-fits-all approach, and it's gradual. When you start engaging in training neuroplasticity in therapy in general, particularly for a condition like CRPS, it's not something that's going to get better in 3 days, in 5 days, and you need to stick with something for a while in order to judge whether it's something that's helpful. And sometimes there can even be a setback in the beginning, because when you start to engage in something new, you start to try a new movement, it can be threatening, it can trigger the pain, and so you need to find an amount that you can do and you can stick with, and not to give up right away if you don't have a perfect experience right away. And also, it's never too late. There's a typo there. It's never too late to try. We know both from animal studies that animals, even that have had pain for a long time, that have had this neuroplasticity changes are there for a long time, they can make changes. And we also know from people, and that takes me to my next slide, which is some of the next steps. So TrainPain, we're hosting a patient presentation on November 15th. This is going to be a story of a patient presenting her own story. It's a patient who had pain for over 30 years, CRPS for over 30 years. She learned about neuroplasticity on her own, and she developed her own, using what she learned about neuroplasticity, she developed her own program of neuroplasticity exercises. She's very inspiring, and I encourage everyone to join. The details are at trainpain.com. Another thing that we're doing as a new initiative in honor of CRPS Awareness Month is we're starting to pull together all this different research and try to make it really simple and straightforward and practical. And we're putting together a guide for patients, and that is already available at trainpain.com. It's an evolving resource. We've just begun it, but we're going to be adding to it over the coming weeks and months. A TrainPain sensory program, this program that we developed with the games and the sensory stimulation, is available. We designed it to actually be something that's very affordable. You're welcome to try it, and you can also reach out and ask us any questions via our website. And I'm also available at any time. You can contact me through the website if you have any general questions about pain, neuroplasticity, or CRPS, and I'd be happy to try to help in any way I can. So let me go to some of the questions that are asked on the chat. Is the app only available on a phone? The app is available on Android phones, iPhones, and iPads. So for tablet users, it's available on the iPad, but it's not available on Android tablets yet. The next question, is it possible to recreate chronic pain in animals? That's a great question. So one of the main ways that pain is studied is in animals. We don't know what animals are feeling because you can't ask them. And pain is a subjective experience. There is no way to measure pain without listening to what a person says they're feeling. There's no brain scan that can tell if someone's in pain. There's no way to know except what a person is saying. So there is no way to ask an animal if they're in pain, but we can look at the animal's behavior. And so if an animal has an injury and it starts licking the wound, or an animal develops hypersensitivity, so if you touch it, and it has a reflex, and that reflex gets more sensitive. So researchers will use that as a way of studying chronic pain in animals. So they'll give the animal an injury, they'll look at the hypersensitivity, and then maybe they'll give one group of animals a medication, or they'll give one group of animals an enriched environment or an exercise, and they'll look at how sensitive they are with those reflexes over time as compared to the group that doesn't get the intervention. Now, there's a lot of problems because obviously that's not the same as humans. And this could be one of the reasons why a lot of medications that look very promising in animals have not translated to be effective in humans, because maybe researchers are not looking at the best thing that really mimics the human experience of chronic pain. Okay, so someone asked about volunteering for different research, so they can. So if a person's interested in research, so there's a website from the U.S. government, clinicaltrials.gov. You can find out about different research. You can search by CRPS. We're running some studies. We're running a study right now at Stanford University for children with persistent pain, including CRPS, and there's other studies going on. But you can go to clinicaltrials.gov and look up CRPS. Okay, when one is super sensitive to pain, how is one expected to not engage in fight or flight? And does it matter where the focal point is? So I think I'm interpreting the question as kind of where to even start. So if you have so much pain, how do you even begin? And I think there's no one answer because it's different for everybody, but finding something that you can do and approaching gradually. So, and everybody's probably already doing this to some degree or another, but if it's too hard to work with the hand, so you work with the elbow or you work with the shoulder, you do the things as close as you can, and you try to very slowly, with repetition, slowly get closer and closer. It's a slow process, but I think for everybody, there's always something to find that you can do, whatever that next step is. One step further than where you are, one step further than what you've done so far. But it's not easy. But I think there's always a place that you can start. And that's really what I think what having a good therapist or a coach is really all about. The therapist or the coach doesn't fix you, but the therapist can listen. They can hear what's your current situation, what can you do, what can't you do, and then brainstorm together with you what would be the next step. What's that next small step that you can take to move forward? And so even though you have to do it on your own, and ultimately it's what you're doing in your day-to-day on a regular basis, that's what's going to make the difference. A good therapist, a good coach can help with the brainstorming, can help give ideas, and can help you monitor the progress on that. So definitely, whenever it's possible, finding a therapist or a coach is definitely the way to go. So the next question is asking about a therapy, but it's not something that I'm familiar with. So I'm going to skip that one.
And I'll jump back on to see, Jim, do you have any questions? Take you off mute really quickly.
Tell me about
Your mic's a little muffled, Jim.
Oh, I'm sorry. Can you hear me now?
Yes.
So talk about the importance of the individual. I haven't speaking.
I think we're gonna have to have you put your question in the chat, Jim, because you started off strong and then it was muffled again. Sorry about that. And I'll check and see if anyone else on the stream has any additional questions.
Oh, okay. Optimism and expectation. So first thing is, I think that that there's a lot of unhelpful information on the internet. Unfortunately, I think that when people are dealing with CRPS and you go onto the internet, you see the extreme end of stories, of real stories where things went really badly, really tough, and you don't see as much of the stories where things go in a really good direction. We know, especially for people who have CRPS early on, we know that the expectation of recovery, it takes a while. We're talking, months, is actually really positive. So a majority of people who develop CRPS it will go into remission. It's not everybody, but it is a very large percentage of people. For people who've had CRPS for a long time, the statistics are that full remission, the chances are lower, but it's still possible. And we know that a very meaningful percentage of patients can still potentially have remission, or if not remission, can have improvement in symptoms, because it's not all or nothing. The symptoms can improve, life function, ability to engage in tasks can improve dramatically. Life can get dramatically better, even if the condition is not fully resolved. The optimism is a very important for a few reasons. Number one, we know that positive expectation changes the whole neurochemistry in the brain and actually is overlapping with the pain system. So we know that when you have positive expectations that a treatment is going to work, that treatment is likely to be more effective. And it's not because the treatment is just a placebo or the treatment is nothing. We know that even if you take a real medication, if you have a real medication and you have positive expectations, they work together and it's more effective than someone who takes the same medication and has negative expectations. We know that negative expectations, or pessimism, or particularly anxiety and expectation that pain is going to increase, releases a chemical in the brain called cholecystokinin. And that chemical blocks your brain's own natural opioid receptors. And so thinking that pain is going to get worse and not believing treatments are going to work actually impair your body's own natural pain regulation system. So there's a physiological effect of optimism. But there's something else too, which is that if you don't believe a treatment is going to work, you're not going to engage in it to the degree that you need to engage in it for it to have an effect. So if there's a therapy that's going to be helpful, but you're ambivalent or you don't think it's going to really do anything, you're probably not going to be able to put in the energy, the emotional energy, the repetition, the engagement that's really required in order for it to work. So I think that it's not just about, think good and it will be good, but optimism combined with a good self-care plan and good therapy is really important combination.
Thank you.
All righty. All right, it looks like we have one more question that just came through. I was getting ready to wrap. Someone asked, I think this is a good question to probably wrap with. What about when you put your whole heart in it and the positivity and it turns out not to work? How would you encourage someone to keep trying over and over?
Yeah, so I think the first thing is not to blame yourself. And so in this lecture, I was emphasizing a lot of things that are in our control. There are a lot of things that we can do, but not everything is in our control. And there's a whole host of reasons why we don't have full control. Everything from genetics, environmental factors that we can't change. I mean, someone who is taking care of a sick, relative, a sick loved one, and you're caring for them and all that stress, that's not something that you can just change that environment or make it disappear. So there are many things that are outside of our control. And the journey to recovery is rocky. It's not always smooth. It's not always straight. And so I think, number one, the first step is not to blame yourself. That, it doesn't mean you didn't try hard enough. Doesn't mean you didn't do the right thing. Doesn't mean you were lazy. But the flip side of that is not to give up. And I think that just because a person has not had a good experience yet, or things have not gone well, doesn't mean that the opportunity and the possibility for things to get better, that door is closed. And it could be that re-engaging at another time with another therapist, with another coach, with some different ideas, different strategies, not to lose hope and not to stop trying. It's essential, and there is a way. And I wish everyone strength, and I don't want this in any way to come off like I think it's an easy thing. This is not easy. This is a very difficult journey. But we know that the possibility for improvement is there for everybody. To a certain degree, there's a possibility to improve for everybody.
Yes. And with that, we will end the first session of our 2023 Treating the Whole Person, Optimizing Wellness virtual conference. Thank you so much, Dr. Schneider. We always love having you join us. And I just want to remind everyone to come back here tonight at 8 p.m. Eastern for a conversation with disability activist, author, and CRPS warrior Tara Moss. We're really excited about that session and all the sessions that we have for the rest of the week. You can check those out at rsds.org/events for our full conference schedule. And just as a reminder, if you have any questions for us, if you need a support group, you need a new physician, you want to write for our blog, anything you may need from us, please send us an email at info@rsds.org and we will get back to you. All righty. Thank you. Bye, everyone.